Faced with this outbreak, the world is looking to us, the United States, and it's a responsibility that we embrace. We're prepared to take leadership on this, to provide the kinds of capabilities that only America has, and to mobilize the world in ways that only America can do. That's what we're doing as we speak. First and foremost, I want the American people to know that our experts here at the CDC and across our government agree that the chances of an Ebola outbreak here in the United States are extremely low. We've been taking the necessary precautions, including working with countries in West Africa to increase screening at airports so that someone with the virus doesn't get on a plane for the United States. In the unlikely event that someone with Ebola does reach our shores, we've taken new measures so that we're prepared here at home. We're working to help flight crews identify people who are sick, and more labs across our country now have the capacity to quickly test for the virus. We're working with hospitals to make sure that they are prepared and to ensure that our doctors, our nurses, and our medical staff are trained, are ready, and are able to deal with a possible case safely. West Africa is facing a very different situation, especially in the hardest hit countries, Liberia, Sierra Leone, and in Guinea. Tom and others recently returned from the region, and the scenes that they describe are just horrific. More than 2,400 men, women, and children are known to have died, and we strongly suspect that the actual death toll is higher than that. Hospitals, clinics, and the few treatment centers that do exist have been completely overwhelmed. An already very weak public health system is near collapse in these countries. Patients are being turned away, and people are literally dying in the streets. Now, here's the hard truth. In West Africa, Ebola is now an epidemic of the likes that we have not seen before. It's spiraling out of control. It is getting worse. It's spreading faster and exponentially. Today, thousands of people in West Africa are infected. That number could rapidly grow to tens of thousands. And if the outbreak is not stopped now, we could be looking at hundreds of thousands of people infected, with profound political and economic and security implications for all of us. And we've devoted significant resources in support of our strategy with 4 goals in mind. Number 1, to control the outbreak. Number 2, to address the ripple effects of local economies and communities to prevent a truly massive humanitarian disaster. Number 3, to coordinate a broader global response. And number 4, to urgently build up a public health system in these countries for the future, not just in West Africa, but in countries that don't have a lot of resources generally. Now, this is a daunting task, but here's what gives us hope. The world knows how to fight this disease. It's not a mystery. We know the science. We know how to prevent it from spreading. We know how to care for those who contract it. We know that if we take the proper steps, we can save lives.
I think that President Obama was correct in sending people from here to assist with the epidemic of the Ebola virus, because we have the best people here, the best doctors, nurses, the laboratories. We do a lot of research, so I think that was the best strategy. It's pretty much a double-edged sword. Had he not sent anybody over to assist, then it would have been like we weren't trying to assist people, and then the virus could have gotten out of control, in which it seems that we are helping to decrease the spread of the virus. Yes, I do think that the people, because they're U.S. citizens, they should have been allowed to come back home and be treated, because they went over trying to assist in stopping the spread of the virus. So, of course, they should be able to come back home, and they did the right thing. And when they did find out they had the virus, they quarantined them and treated them as they should have been, because they did what they felt was necessary as far as going over. So we should oust them. They're our U.S. citizens.
Ebola is a type of hemorrhagic fever, which means one of its most prominent symptoms is heavy bleeding, either internally or externally. But blood loss isn't what kills its hosts. After causing flu-like symptoms like vomiting and diarrhea, Zbov targets the entire circulatory system, causing blood vessels to fail, blood pressure to drop, and eventually all of the major organs to shut down.
On a scale of 1 to 10, I think that Ebola for me would score probably about a 10, because it's a scary virus that's being spread through bodily fluids, vomiting, blood, different things like that. And that's not the scariest part, though. The scariest part is the fact that they don't have a cure for or a vaccine for it, because of the fact that it's something that has not been tested as much right now, and we don't have a cure for it. So that's probably the scariest thing. If people continue to get it and it continues to spread, the little vaccine that we do have that they think that to help the cure, it's not going to be enough for thousands and thousands of people. So I think that probably would score a 10.